Community Health Centers of the Central Coast, or CHC, is a network of 31 federally qualified health centers spanning the San Luis Obispo County and northern Santa Barbara County regions. In July 2020, ACEs Aware awarded CHC with a provider engagement activity and a peer-to-peer learning grant. These grants have empowered us to engage our providers, support staff, and care coordinators in activities to create not only a trauma-informed, but a trauma-responsive team. One impactful transformation involved front-loading our staff with strength-based resiliency skills taught through the community resiliency model. While this equips staff to support themselves, it also allows them to teach these vital skills to their patients. CHC also collaborated with a fellow ACEs grantee, Beverly Kyer, from the Kyer Group Corporation to mitigate compassion fatigue and burnout in providers as they engage in ACEs work amid the pandemic. An essential focus of our ACEs initiatives at CHC has been responding to our patients' needs. When patients screen positive for ACEs, our behavioral health navigators link them to applicable internal or external resources, such as substance abuse or perinatal mood disorder counseling services.
After a patient is screened and identified as having an adverse childhood experience related to mental illness or substance use, a social work clinician, such as myself, reaches out to provide behavioral health consultation, intervention, linkage to appropriate providers, all within our integrated system of care. By having a proactive and preventative approach, we're able to provide buffering resources to the patient and ensure that patients are less likely to fall through the cracks after being screened.
Responding to our patients' needs in a strength-based and dignified way that links them to local resources is a critical action for our team. As part of this goal, we have partnered with local community-based organizations, such as the Food Bank of Santa Barbara County, to provide food to our patients experiencing food insecurity, and Fighting Back Santa Maria Valley for parenting classes and family advocate support.
Going forward, as we continue to respond to our patients' and community's needs, our goal is to promote and provide preventative ACEs screenings and toolkits for every family we partner with in raising their child. Our vision is for every parent with a newborn to leave our clinics with the knowledge, tools, and resources to prevent ACEs and protect the next generation. Through this work, we want to promote well-being and positive childhood experiences. Thank you, ACEs Aware and Dr. Nadine Burke-Harris, California Surgeon General, for helping CHC and all our California network partners to prevent ACEs and create a much healthier generation.
Our ACEs grants allowed us to come together in partnership, to break down silos, and to have dedicated time to create a shared vision of interdependence and connection, a cross-sector continuum of care. Our goal was to identify opportunities to grow a network that attends to the health and well-being of children, adults, and families. To this aim, a core team of individuals from health, social services agencies, community-based organizations met weekly to nurture a trauma-informed collaborative, utilizing the 4 components of our ACEs grants to achieve our goal. Offering training to raise awareness, connecting to advance system coordination and alignment, sharing our learnings, and determining our resources. Implementing our Contra Costa network of care centered around hope, healing, and recovery. All are welcome here. Thank you.
I'm Allison Stalcup-Beckwar, CEO of Lincoln Families. We are honored to be among the first round of ACEs Aware grantees and celebrate with you today. Lincoln Families has a long history of disrupting the intergenerational transmission of trauma. Everything we do is aligned with the ACEs Aware movement. We know our successful outcomes depend on partnering with families, communities, and other provider organizations. Through this grantee experience, we have been able to work more closely with ACEs Aware and are grateful for the California Surgeon General's leadership and vision of this important work. We are so excited to help spread the word about ACEs and toxic stress through our PAINT program. PAINT, which stands for Psychotherapeutic Art Interventions for Navigating Trauma, reached 55 school-based mental health providers throughout California. Since schools are where youth spend a majority of their waking hours, this is a perfect place to co-locate mental health services. Through this work, we have been able to raise awareness about screening and treating toxic stress in children, caregivers, teachers, and our own staff. We will continue to create responsive programs and build community capacity to mitigate the impacts of trauma and toxic stress. Thank you, ACEs Aware, for lifting up this important work for our youth and families.
So ACEs is short for Adverse Childhood Experiences. They are severely stressful or traumatic experiences that occur before anyone turns 18, and something that individuals don't have control over when or why they happen.
Trauma-informed care acknowledges that most of us in our lives have experienced some adversity. And we want to routinely screen for that because we know that the amount of adversity or trauma that a child experiences early in life can affect long-term health outcomes.
We have learned that people that have experienced ACEs are more likely to develop chronic diseases, for example, cancer, diabetes, heart disease.
So as an organization, we are starting to screen for this and focus not just on the problem later in life, but screen for it early so we can be part of the solution by using prevention.
So some of the ways that we've seen our ACEs screening initiative impact our patients and our staff is that we have been able to shift the conversation from being reactive and feeling like we have to fix something after the fact to being proactive and preventative, which is what primary care is all about.
The impact, the response that patients have had when we ask these questions has been amazing, and it really opens up a whole different experience for them and a connection with the staff that is working with them. I've had patients tell me no one has ever asked me this, and then, like, I'm the first one asking this, and they open up.
I personally have seen a huge buy-in, not only from leadership, but also from my coworkers, their front office workers, everybody here.
Our staff and our internal processes can impact how we do our work every day, and that impacts our patients.
When they're giving me the answers, I'm already thinking, what am I able to provide for this patient? And it could vary from offering behavioral health or outside resources. There's a lot of mothers groups. We have all kinds of groups right now about meditation and how to deal with stress.
We believe that by changing our attitudes and our direction in our work to look more at people's strengths and to look at the strengths of the community we serve, it really makes a difference, and not only for our community, but also makes our workday better and a lot more fun.
Marin Community Clinics is deeply committed to being a trauma-informed organization and to promoting a culture of resilience for our staff and for our patients. It's a journey we're all on together, and I'm so excited for what's next.
Greetings from the Landon Pediatric Foundation and ACEs Aware Ventura County. We are so grateful to have had this opportunity to further the ACEs Aware mission and bring more knowledge and awareness to screening and treating ACEs and toxic stress throughout Ventura County and beyond. Over the course of our grant period, we have had the opportunity to foster community partnerships and engagement. We have built an ever-growing online presence, and in developing an informative and enlightening lecture series which not only serves as provider training, but also to engage the community as well. We are excited to see how ACEs Aware will continue to improve patient experiences and outcomes and expand beyond just this state initiative in California.
Thank you for joining us on our mission to bring better help, better health, and better hope to Ventura County and beyond.
Through the support of the ACEs Aware Initiative, the Pediatric Resiliency Collaborative, or PERC, and Resilient Santa Barbara County have formed the Santa Barbara County Network of Care and developed a framework for training clinics as well as our community partners. The trainings aim to increase awareness of ACEs and provide shared language and common goals across all sectors of our network of care. PERC has trained more than 130 pediatric providers and clinic staff, beginning with 5 clinics throughout the county. Staff appreciate the clinic-wide approach, technical assistance from PERC staff, and ongoing consultation with community partners. Core trainings were adapted for community organizations participating in buffering service grants and the Network of Care Leadership Committee. Trainings feature members of our network and will be available with additional resources through our training web portal. The Network of Care grows stronger every day with our continued efforts to connect and collaborate. Together, we forge a path towards our vision, a county where families and children are healthy, resilient, and thriving in their communities.
My name is Gary Taylor, and I am the Program Director at the Raise Foundation. We are an organization lucky enough to partner with the Chicago School of Professional Psychology and Orange County's Child Abuse Prevention Council as a part of the ACEs Aware Initiative Round 1 to create an Orange County network of care. We've had some incredible outcomes over this first year, or several years now at this point, including over 5,000 participants coming to the various workshops we've had, over 3,000 continuing education units distributed as a consequence. We featured Dr. Eric Ball during last year's Blue Ribbon Kickoff ceremony, which was a treat. We had a community forum in which ACEs was one of the preeminent topical areas, and we finished the year with the first ever Orange County end-of-year ACEs Aware convening with all of the different Orange County grantees collaborated. It's been an honor. We are so thankful for Dr. Nadine Burke-Harris and the California Office of the Surgeon General. We're grateful to the Aurora Health Group for this opportunity and for their continued support. And I'd like to give a shout out to all of the other grantees in Orange County and California for doing such great work. Keep up the good job, and I hope to see you all again soon. Thanks again for the opportunity. Go Blue Ribbon.